Let's break down Apixaban, sold under the brand name Eliquis, a modern anticoagulant that's changing how we prevent blood clots. Apixaban is part of a newer class called DOACs, direct oral anticoagulants. Unlike warfarin, it doesn't require routine blood monitoring or major dietary restrictions. It works by blocking factor Xa, a key step in the blood clotting cascade. This helps prevent clots from forming in the veins, heart, or lungs. Apixaban is commonly used for atrial fibrillation, to prevent stroke, deep vein thrombosis, pulmonary embolism, after certain surgeries like hip or knee replacement. Why doctors prefer it? Predictable dosing, lower risk of serious bleeding compared to warfarin, fewer food and drug interactions. Typical dose is 2.5 milligrams or 5 milligrams taken twice daily. Possible side effects include easy bruising or nosebleeds, bleeding gums, rare but serious, internal bleeding. And here are some precautions. Not for patients with mechanical heart valves. Kidney function needs to be checked before use. Don't stop suddenly. Clot risk can rebound. Apixaban has made anticoagulation simpler and safer for many people, but it's still a powerful drug that must be taken correctly. If you found this helpful, hit like and subscribe for more medical animations.